Why we need the Washington Health Trust. Senate Bill 5233, House Bill 1445. To understand why we need the Washington Health Trust, we must first understand what's fundamentally wrong with the healthcare system we have. It's not just expensive or inefficient. It is miscoded at its core. The current for-profit model is programmed with a fatal line of code. Its financial success is tied to managing sickness, not creating health. Your wellness is accounted for as a liability. Your chronic illness is a revenue stream. Every shocking premium hike, every denied prior authorization, every narrow network is just the system executing this broken code. So how do you fix it? You don't try to patch the bugs in a corrupted program. You rewrite the code from the ground up. This is the Washington Health Trust. It is the new operating system for healthcare in our state. Its prime directive is simple, revolutionary, and the direct opposite of what we have now. Health is the bottom line. Financial success is no longer measured in medical losses managed, but in populations kept healthy, in problems prevented, in early detection. The trust isn't a tweak to the old model. It is the antidote to it. Let's be clear, the system isn't broken. It's working exactly as designed. Soaring premiums and deductibles aren't accidents. They are symptoms. The diagnosis is a sick care business model. In this model, your wellness is a financial liability. The profit is in managing your chronic disease. The engine is called the medical loss ratio. To the industry, every dollar spent on your care is literally accounted for as a loss. Their profit comes from minimizing that loss. Look at the Gouge planned for 2026. It builds on 2025's double-digit rate hikes. This isn't a crisis, it's the business plan. For a typical Washington family, this means total costs, premium plus deductible, nearing $30,000 a year. This isn't insurance, it's financial paralysis. And that high deductible has a purpose. It rations prevention. You skip the checkup. You delay the screening. A minor issue becomes a major, lifelong, and profitable chronic disease. See the model perfected in Medicare Advantage. A fixed budget for seniors with predictable needs. The incentive isn't to cure, but to manage sickness for profit. Or look at the Monopoly Playbook. UnitedHealthcare, the insurer, owns Optum, the clinic and pharmacy. They profit from your premium, then profit again from your treatment. It's a closed loop. This isn't abstract. Optum clinics and surgery centers are here in Washington. The sick care monopoly is operating in our communities. Here is the inescapable conclusion. The gouge, the rationing, the vertical integration. These aren't glitches. They are the system's primary features. We cannot regulate a profit-driven system to prioritize health. The perverse incentive is the fatal flaw. The prescription is to change the DNA. We must build a system where success is measured in population health. The antidote is the Washington Health Trust, a publicly accountable system where health is the bottom line. First, it realigns the incentive. $1 spent on prevention saves thousands in future treatment. Health becomes the best investment. Second, it ends the denial playbook. No prior authorization for prevention. Your care is between you and your doctor. Third, it breaks the monopoly. One public negotiator sets fair prices. The closed profit loop is shattered. The result? A system that serves Washingtonians. Predictable costs for families. A level field for small businesses. A focus on wellness. We have a choice. One path leads to more gouge, more sickness, more corporate control. The other leads to health, prevention, and common sense. Let's choose health. Learn more. Contact your legislator. Support the Washington Health Trust. The cure is within our reach.